Anaphylaxis is a life-threatening allergic reaction one can encounter if they're allergic to certain food substances like shellfish, that is prawns, or other shellfish, egg, peanut, or other tree nut like almonds and other nuts, milk, wheat, sesame, sometimes chana dal or other dals, which are common among them, or can be due to drug allergy like a painkiller drug like diclofenac, usually injectable, sometimes oral also, and commonly encountered cephalosporin antibiotics. It can be due to insect stings like bee sting or other insects, and very rarely due to latex in a rubber used or in gloves. Patient can get severe reaction, and if not treated immediately they may not survive. You will get rash and may get another symptoms like difficulty in breathing, cough, or choking. In such situation, when two systems are involved, the treatment is immediate adrenaline. Immediate adrenaline, and those who are suffering from this in abroad, in Western countries, they get EpiPen. This EpiPen is not available here in India. In that case, you can keep this adrenaline injection, which is only about less than 20 rupees it costs, and pre-fill it with a syringe. And that can be self-injected whenever needed. It can be kept for almost 6 weeks, and it should not be exposed to light. So if it becomes dark like this, it needs to be discarded, or for protection you can put a silver foil and keep it in a spectacle case for almost 6 weeks, and before the expiry date it can be used whenever needed. Remember, many times after injection and all, one can get syncopal attack. This syncopal attack are simple and patient can come up again. But if it is anaphylaxis, you will get some other symptoms also, not just collapse or syncope, but you will get a reaction like rash, a severe reaction like swelling in the eyes or face, and then can be difficulty in breathing, basically because of the swelling in the larynx here. That time you will get difficulty in breathing. This is the time or you need to give injection adrenaline, and the self injection can be taken, or every doctor has to keep this in the emergency, and every injection that is being given, the patient has to be observed for about 15 minutes or half an hour. So anytime anybody can get an injection, or anytime the first dose of injection is given in the hospital, doctor has to be available and this injection has to be given. Upper lateral thigh is the best place for self-introduction because it has to be given in the IM, intramuscularly, and the dose is 0.5 cc. This ampule is of 1 cc and dose is 0.5 cc for adults in intramuscular muscles. The children dose is 0.01 cc per kg, so it is 10 kg, 0.1 cc. In case of syncope, and if you fail to recognize whether it is an anaphylactic reaction or a syncope, and you give the injection adrenaline, nothing will go wrong, because syncope otherwise also will get up, but if it is reaction, patient will not get up. So identify that it is an anaphylactic reaction and act promptly, immediately. Many times it has been noted that patients are given only injection antihistaminics like Avil and or Decadron or dexamethasone or your hydrocortisone injections. They do not act immediately, and many times the organ failure can occur and patient lands up in a trouble. Even those patients who had an anaphylaxis and those who recover immediately, they usually recover immediately, they require to be observed for another day, as the second phase can occur. There is a biphasic reaction, and anaphylaxis can reoccur again after 12 hours. So hence they require to be kept in the hospital, and once they improves very well, they require to be fully evaluated. You can refer them to those who treat with allergy and get him or herself evaluated and the appropriate treatment measures or avoidance measures can be initiated after that. Thank you.